I will still start with the presentation up till the point where I stop the. I'll present the same thing until the point where I stopped a few weeks ago, and then I'll continue from there on. So now I would like you to sit comfortably in your chair, take a deep breath in, let it go, and close your eyes. And by the way, you are wide awake and listening to me. And if you weren't awake, you wouldn't hear me. Picture yourself by the ocean, feel the cool breeze on your skin, you can hear the waves, and you're completely at ease. And when I count to 3, you are going to cluck like a chicken. By the way, that is the Hollywood version of hypnosis, ladies and gentlemen, and luckily it is bunk. So today we're going to look at the myths and facts about hypnosis. So what is hypnosis? So hypnosis is characterized by a trance-like mental state in which people experience increased attention, concentration, and suggestibility. So people in a hypnotic state, they often seem like they're sleeping, but the truth is they're in a state of hyper-awareness. They're in a state of like, they block out their surroundings, right? They're totally focused. So a trance-like state, what is a trance-like state? It is an altered form of consciousness where a person is neither fully awake or fully asleep, right? So in between wakefulness and sleep. So we do experience trance-like state naturally. For experience when you are driving back on your way home and you can't really recall what happened, which route you took, right? Or when you're daydreaming and you're totally immersed in your own world, you're not sure what's happening surrounding, or when you're watching a football match, when your wife calls you, you're not sure because you're totally immersed in the experience. Or when you are praying and chanting, you're totally immersed, focused in your inner experience, right? Listening to music as well. Trance-like state can happen naturally, can also be induced by chemical means, like if you drink a bit of alcohol, you're feeling a bit tipsy, that is kind of a chemical-induced trance state. Of course, in hypnosis, what we want to achieve is to use words to induce, to bring and guide a person into a trance-like state. Okay, so the brain waves also change during trance state. Change from a more conscious beta wave to a slower alpha during light trance and a even slower theta wave during a deeper trance state. Right, so as I was saying a few weeks ago, history of hypnosis can be traced back to even, I think, across all ancient cultures, right? The earliest culture, even ancient Hindu or Indian cultures, they often use rituals to heal sick people. Greek cultures, Egyptian, one of the most worthy mentions or example is the Egyptian sleep temples. This is like the ancient hospital for the Egyptians, right? So they use these rituals. They have these rituals to guide sick people into trance, and they suggest that healing happens when they cast out evil spirit and God heal them. So the father of hypnosis, this guy, Frederick Anton Mesmer, where the word mesmerize came from, he's an Austrian physician. He suggests the word animal magnetism. Animal magnetism means there is a transfer of energy between animate and inanimate object. And the system of healing is based on the disturbance of universal energy field. So he would have patient either held onto a magnet or a person's hand to balance out the energy. So what he found is that when the patients he healed by holding on the magnet or holding on to a person's hand, the patient actually go into a state where they are like between conscious and unconscious, right? Semi-conscious state. So there's actually he bring a patient into trance-like state. So the father of modern hypnotism, known as Milton Erickson, is an American psychiatrist. He actually refined a lot of techniques in hypnosis, techniques such as using indirect suggestion, verbal and non-verbal pacing techniques, metaphor, confusion. All these techniques he designed to bypass the conscious mind and to give suggestion directly into the subconscious mind. So techniques like things like, say, you already know something that you don't even know that you know. So when you say such a word to a person, their conscious mind is trying to work out what are you saying, and when they're trying to work out, that actually bring them into trance. Right. So to understand how hypnosis work, we have to understand the topography of the mind. This is a metaphor developed by Sigmund Freud himself, the iceberg metaphor of how the human mind works. So at the tip of the iceberg is the conscious level, where we are aware right now, our thoughts, our perception. And below that is the subconscious level, which we are not directly available to us, but when stimulated, it can be brought to the conscious level. For example, if I mention a name of a school teacher during your primary school time, then you might, some pictures or some memories might come up to the conscious level that you don't even know that you remember, right? So deeper down is the unconscious level, and it's a huge chunk where it stores our fears, our motives, our wishes, and urges. This part of the unconscious level is not readily available to us. We are not conscious because what Freud said, if the unconscious become conscious, we will become very anxious, and it is too distressing for us that we cannot take it, right? So, but the unconscious actually determines how we behave, determines our tendencies, our compulsions. If you look at some people with addiction problems, they have like cigarette smoking or alcohol problems, right? They continue to have this kind of tendencies, despite knowing that it causes a lot of problem to them. Or perhaps you have heard of some women or lady who continuously find a spouse who physically abuse them, right? So all this behavior actually stems from the unconscious. So Freud knew that, and he knew that in order to change a person's behavior, he had to target the unconscious. He had to do some work at the unconscious level. So he developed this technique, psychoanalysis, where he would ask his patient to lie down on a couch, and then he would just ask his patient to just mention whatever comes to mind, right? Whatever, either trivial or embarrassing, just mention it. So from there, he would try to tap into the person's unconscious mind and find out what is the conflict. So the patient might be talking about a cat, might be talking about the weather, but the truth is, he will analyze it uh, to see whether there is what he termed as a Freudian slip, right? Something that the patient accidentally said that reflects a conflict in the unconscious mind. So in hypnosis, what we want to do, what we want to achieve is actually, when we put patient into trance, is to bypass the conscious and subconscious level, so that when we give suggestion, we give it directly to the unconscious level. Okay. So again, just a recap, what happened during hypnosis. First, we relax the patient, and then we remove distraction. We get the patient to focus on our voice, and then we bypass the conscious mind when the patient's in trance, so that the resistance is lower, and then we give powerful suggestion directly into the subconscious mind. Okay, so as I mentioned last few weeks, some of you might be hypnotized by your cat. When you go home, look into my eyes and you will give me tuna. Right. So what are the indications for hypnotherapy? There are a lot of indications for hypnotherapy, ranging from smoking cessation, weight loss, eradication of fears, and some even say chronic pain. There are a lot of data actually for chronic pain, even acute pain as well. Psychosomatic disorders such as irritable bowel syndrome, I will mention towards the end. I'll give you some evidence. And also as adjunct to anesthesia. We call it hypnoanesthesia. In fact, in the 18th centuries, there are surgeons who only use hypnosis as the means of anesthesia for major surgery. Okay, so let's discuss about a few myths that about hypnosis. So myth number one, the hypnosis will be able to control my mind. So the truth is, no one can control your mind unless you let them. Hypnosis the process is like, as I mentioned a few weeks ago, you are the driver, right? I am your co-pilot. So I might tell you to turn right, turn left, but it is you who decided where you want to go, right? If I give you suggestion but you don't want to follow, then of course I won't be able to do anything. So myth number 2, I can't be hypnotized because my mind is too strong or disciplined. So I just repeat my story few weeks ago. When I first learned hypnosis, a lot of friends or relatives will come up to me and say, "Hey, come, Wong, you learn hypnosis. Like, try to hypnotize me. Try to see whether my mind is strong enough or not." So the truth is, I just told them that you can't be hypnotized because you don't want to. I can't hypnotize you because you don't want to, right? You have to be willingly want to be hypnotized. So, but I told them that the truth is you're already being hypnotized in a daily basis. Yeah. I give the example of the other day of when you go to McDonald's, right? The idea of going to McDonald's is actually the suggestion is putting into you by the advertisement. When you're driving, you see the advertisement, you see the billboard of McDonald's. You might not really pay attention, but that suggestion actually go deep down into your subconscious. And when you're hungry, suddenly McDonald's just pop up in your mind, right? Okay. So for those of you who love to watch movie like me, you might have watched these two movies, Inception and Focus. Well, in Inception, the interesting thing is this bunch of people, right? They actually go deep down into people's dream, and what they do is they plant an idea into that person's dream, and that person actually wakes up to believe that the idea come from themselves, not from other people, right? So in Focus, there is this scene where Will Smith was watching a American football match with a wealthy man. So he make a bet with that man. He say, you just choose a player in the football field, right? According to their jersey number, just choose one. If I can guess it correctly, then I win the bet. So eventually he get it correctly. But how he did it was, he actually preempt the wealthy person's mind when the wealthy person since he left the hotel, right? The clerk, the secretary is actually wearing earrings of I think number 66. So everywhere he go, had that number 66, even billboards while driving. So he actually put the suggestion into the wealthy person's mind. So when the wealthy person he choose number 66. Okay, myth number 3. One of the risks of hypnosis is getting stuck in trance. Again, this is not true. As I mentioned just now, trance is a normal state that we enter and exit all the time. Right? If the hypnotherapist left the room, you would spontaneously just come out of trance. Like you would just wake up from sleep. It's the same thing. Well, people can't lie when they are hypnotized. Again, hypnotism is not a truth serum. What happens is when you are hypnotized, because you're in trance, your resistance actually go down a bit, but you will still have your control whether you want to lie or not, or you don't want to say something that you're not comfortable with. We can't control you to do something that you don't want to. Okay, so myth number 5, hypnosis can help you to uncover memories. Although it be more possible to retrieve more memory during hypnosis because you're in a trance state, but you are actually more likely to create false memory as well. So because of this, many hypnotherapists remain skeptical about using hypnosis for memory retrieval. So I want to talk about this book. It's a bit of a controversial. It's a past life regression. Apparently, this psychiatrist, what he did was he tried to do regression therapy to one of his patients and accidentally brought his patient back into a previous life, full of controversy. So this Dr. Brian Weiss, a bit about him. He is actually a head of pharma psychotherapy unit. So psychopharmacology unit. So it's a very biological based therapy. So when he found out this, he is actually very reluctant to write it into a book, but eventually he still wrote it. And if you ask me, do I believe in this? Of course, I would say no, because when you're in trance, a lot of false memory can happen. But nevertheless, I think this book had a lot of lessons that we can learn from, and it's quite interesting to read. So for you who are interested, you can have a look at this book. Okay, so let's examine some evidence for hypnosis. There's hypnosis for pain control. In a 2003 review of controlled clinical studies, Dr. Patterson found that hypnoanalgesia is associated with significant reductions in rating of pain, need for analgesics for sedation, nausea and vomiting, and length of stay in hospitals, right? Even the surgeons and other healthcare providers reported that they had significant higher degrees of satisfaction with their patients treated with hypnosis rather than the other patients. And Dr. Patterson also indicate that hypnotic strategies are equivalent or more effective than other treatments for both acute and chronic pain, and they are more likely to save both money and time for patients and clinicians, right? Okay. So hypnosis for the treatment of psychosomatic disorders, irritable bowel syndrome. So in a study in 2003, 204 people suffering from irritable bowel syndrome. So treatment consisted of 12 weekly sessions of hypnosis, each 1 hour each. 58% of men and 75% of women reported significant symptom relief immediately after finishing treatment. But more interestingly, after 6 years, when they follow up the patients, more than 80% of those patients who reported initial relief were still improved during that time, 6 years later. Okay. So you might be thinking, wow, so hypnosis is such a wonderful tool. Why not use it for, mainstream mental illness such as depression, which is very prevalent right now? So according to the Malaysian CPG Management of Major Depressive Disorder, second edition last year, so hypnosis fall under the category of complementary and alternative treatment because there is no retrievable evidence on hypnosis in the treatment of depression, right? Most of the studies most of the meta-analysis, the quality of the studies were poor. So the recommendation of psychotherapy for depression is still mainstream cognitive behavior therapy, interpersonal therapy, behavioral therapy, problem-solving skills, and internet cognitive behavior therapy. So right now, if you ask, probably you were thinking, okay, Dr. Wong, since you know how to do hypnosis, can I refer you cases of IBS or patients with chronic pain? I would say right now, not yet. I'm sorry, because I only do hypnosis to get my patients into state of deep relaxation, right? To get the effect of deep relaxation. So right now I don't accept any referrals for chronic pain or any hypnosis for psychosomatic disorders. Right. So before I end, I would like to end this talk with a quote by Milton Erickson himself. Most people walk through the world in a trance of disempowerment. Our work is to transform that into a trance of empowerment. Okay, thank you very much. And now I guess I would take some question if you had some.